Thanks for watching this video, but understand that this is just one small part of a comprehensive video that I did about managing yourself on testosterone replacement therapy. So if you do want to see the full video, I'll put a link at the end of this video and one down in the description. Quick disclaimer, this is not medical advice. This should not be used to treat or diagnose medical conditions. This is for educational and entertainment purposes only. Now let's get into this video. Let's talk about hair loss as it relates to testosterone replacement therapy. Now look, this is something I am personally concerned about, so it's something that I personally address. First and foremost, you need to understand that some guys are not susceptible to hair loss. If you're in your 30s, 40s, and you got one of these hairlines that start from one ear, go to the next, you've been on testosterone for years, you got a full head of hair back here, then congratulations, dude. You can skip over this part. You don't have to worry about it. But for the rest of us that got like that little 2-car garage, maybe we're starting to get a swimming pool in the back, this is a part for you. First and foremost, there's some things that we can do that has nothing to do with androgens or TRT that may help with hair quality. First and foremost, if you notice diffuse thinning, basically you're losing hair all over or you're losing it in patches, that might be related to testosterone, or it could be related to things like your thyroid or other autoimmune diseases. So rule that out first and foremost. Get your thyroid checked, make sure everything looks good, and make sure that you're not dealing with an autoimmune disease, because that has nothing to do with your testosterone. At least not that I know of. Secondly, your hair is a reflection of your health. Now I get it, like the stuff on top is dead, but at one point it was alive. Like how your body made that hair, there was a portion of it that was actually alive. And as a result, the healthier you are, the healthier everything's gonna be. So make sure you're not dealing with any type of like nutrient deficiencies that could be impacting hair quality and cause some thinning. So address your nutrition. And then lastly, high levels of stress can contribute to hair loss. So manage your stress. So these are things that we've managed without even touching androgens. We've managed the thyroid or autoimmune disease, manage your health and nutrition, and then manage your stress levels. Now, let's say you're doing all those things, thyroid looks good, stress is managed. Now let's actually talk about testosterone and how it contributes to hair loss and some of the things we could do to maybe step in to prevent that. So testosterone is an androgen. Androgens in and of themselves can contribute to hair loss. So don't act like if we do this one therapy, all of a sudden you're good to go. So testosterone itself in the highly susceptible individuals can still contribute enough to cause hair loss. But for most people, they're not that susceptible. And as a result, what's usually causing the hair loss is something called dihydrotestosterone. So testosterone goes through a process called 5-alpha reduction, or the enzyme 5-alpha reductase acts on testosterone to form dihydrotestosterone, which is significantly more androgenic. And the androgenic properties of testosterone and DHT are some of the things that can contribute to hair loss. So if we can stop some of that conversion of testosterone to DHT, we can prevent some of the hair loss. We do that with a medication called Finasteride. So Finasteride is a 5-alpha reductase inhibitor, so it prevents some of that conversion. It's not all sunshine and rainbows. We're going to talk about side effects later on. But understand that Finasteride might work for a lot of people, but it's not going to work for everybody. Some guys that do it, they swear they even grew hair back. Personally, I've been on and off it now for like 7 years, and I think it's helped a lot. So I won't say that it grew back hair, maybe a little bit in patches that were just falling out, but it definitely froze my hairline in time. The protocol that I like to follow and we follow with our patients is 1 to 1.25 milligrams 3 times a week. This does seem to kind of freeze hair loss in its place for most men, not everybody. And it also seems for us that we have less side effects with this actual dosing protocol. Speaking of side effects, DHT is still an important male hormone. Some guys will say it's completely useless in adult males. It's only useful in the youth. I disagree with that. I do think DHT, at least anecdotally, and some studies and some research suggest can contribute to things like erectile quality. And in fact, some guys will experience erectile dysfunction when taking Finasteride. And there is even some evidence to suggest that Finasteride can cause irreducible erectile dysfunction. Now, do I think that's the case for most people? I really don't. I think that's exceedingly rare. I do, and this is just my opinion, not anything clinical. I think most of that has to do with what's going on between the ears instead of what's actually going on with the androgens for these people that have persistent finasteride syndrome. But go on Reddit and you'll find guys that are like, absolutely not, I feel great in every other way, but I cannot maintain an erection. So understand there is a risk to taking finasteride. And let's say you're somebody that you started taking finasteride, you have side effects, or you don't want to take that risk. There's another option that's not really related to hormones, to testosterone or DHT. It's basically you're trying to grow more hair than what you're losing from the androgenic alopecia or male pattern baldness. So you can use growth agonists, things like minoxidil, so you can create this minoxidil supported hair. So let's say you're losing 1,000 follicles a year through miniaturization and androgen receptor, basically the androgens acting on your hairline, but you're able to gain 1,000 a year with minoxidil supported hair. Well, your hair is going to look great. Are you still losing hair? In a way, yes, but you're offsetting it with a growth agonist. So those are some ways that you can address it, but understand that that also has a risk. Some guys will get a headache from minoxidil. Some people will have some issues. I remember one guy started it. He was saying he was having palpitations in his heart. Again, I think those side effects are rare. You can buy this stuff over the counter, but these things, there's no such thing as a free lunch. Understand that when you're intervening with testosterone to DHT, or even when you're doing a growth agonist, it's not all sunshine and rainbows. There can be a risk to that. So now that we understand how to manage hair loss, both from non-hormonal and hormonal perspectives,